Welcome back. So, coming to the third session of our talk, fetal period, is estimation of embryonic and fetal age. As I've already told you that we will be discussing in this session what are the changes in weight during the fetal period and how it actually grows out. Fetuses, fetus during the 6 month, what are the changes which are occurring to the 6 months? Development during the last 2 months, then how actually what happens, how the maturation and weight increase in weight occurs in the last 2 months. So what are the changes during the fourth and the fifth month? These during this time the fetal lengthens rapidly and end of the first half the intrauterine life reaches up to 15 centimeter of crown lump length, which is the half the total length of the newborn. On average, this is what exactly I told you, that if you see the crown lump length, this will be, there will be a linear increase. It will be increasing gradually, and there will be no lag period in it, that there will be for some time there will be a very small increase and then a sudden increase. But if you compare weight with the crown lump length, initially there is very small increase till the 7th month. But the last 2 months there is an exponential increase in the weight, resulting in a large amount of the weight increase the last 2 months only. The weight increases little, and by this time it's still less than 500 milligram. And even you saw in there was a table which by the time by 28 weeks, by the 7th month, the weight was less than 1.5 kg. It was just 1.3 kg. But in the last 2 months, it became 3.4 kg, which is almost 2.5 times increase. So that was just present two months back. The fetus is covered with a fine hair called nugo hair. Eyebrows and head hair are also visible. And this type of hair is gradually they shed off and normal hair starts to come. But these hair are actually present in the intrauterine life. The fetal movements can now be felt by the mother usually at 4th to 5th month of the time. Certain mothers start feeling it by 5th month, others by maybe at early 6th month of the time. But usually by 4th, 5th month, the fetal movements, the kicks can be easily palpable and can be felt by the mother. So, coming to the changes in weight during the fetal period, during the second half of the intrauterine life, the weight increases considerably, particularly during the last 2.5 months, when 50% full-term weight, approximately normal value is 2.5 to 3.5 kgs. It's usually on average it is 3.2 or 3.25 kgs, but normally average weight is from 2.5 to 3.5, and above 3.5 is overweight, below 2.5 is underweight or low birth weight. So, what are the changes which occur during the 6 months of intrauterine life? The skin of the fetus is reddish and has a wrinkled appearance because of the lack of underlying connective tissue. Now, for this the 6 months of intrauterine, the connective tissue is actually forming at this time. The skin is also forming, and there may not all the layers may not be present, but gradually they are maturing into all those 5 layers which would be present at the birth. The fetus born early in the 6 months has a great difficulty surviving, although several organ systems are able to function, but a respiratory system and nervous system may have not differentiated sufficiently, and a coordination between the two systems is not yet well established. Usually, earliest by 6 months, there is a chance, but there's a very less chance. By 7 months, usually there's a high likelihood that if the lungs mature quickly, and usually there is a steroid injection given to mature the lungs in case of if the baby is born prematurely, so that it can survive. There is a chance that it survives, but by 6 months there is highly unlikely, not because the reason organs have not developed, but yes, or development of organs is one point, and their internal connections which make them work together synchronously as a one unit is yet to be achieved. As a result, by 6 months, if the baby is born 6 months at the age of 6 months so prematurely, it usually doesn't survive. Fetus has a crown lump length of about 25 centimeter. This is at the edge of almost at the end of the 6 months and weighs about 1.1 kg. If born prematurely at the end of 7 months, almost which is 28 weeks, the fetus has a 90% chance of survival. Why we call it by end of 7 months? Because majority of the length has been achieved, respiratory epithelium would have matured, the connections between the respiratory and nervous connections would have been established, the body would have started to function as a one unit, and different organ systems are actually working in a synchronous manner. But the 7th month of time, if the baby is born that prematurely, there is sufficient chance that he or she would survive. Although definitely intensive care would be needed, incubator care would be needed, but he or she would most likely survive. Coming to development during the last 2 months. Now, this is just a recap of it. That during the last 2 months, the fetus obtains well rounded contours as a result of deposition of subcutaneous fat. By the end of intrauterine life, the skin is covered with a whitish fatty substance called as vernous sesosa, which is shed off gradually when the parturition occurs, composed of secretory products from the sebaceous glands. At the end of the 9th month, the skull has the largest circumference of all parts of the body, an important fact with regard to its passage through the birth canal. Now, coming to the normal birth, when the simple vaginal delivery, it has to be different factors are playing different role. Any disease which is affecting the skull of the baby, for example, if it has a cerebral spinal fluid indentation or hydrocephalus, in which actually the head size is much larger than the normal, or anything which reduces the birth volume of the birth canal, for example, in certain pelvic geometry of the mother is such that the pelvis is very short and small, then this would also affect the normal vaginal delivery. So if the head is large, no, above than the normal limits, or there is small birth canal volume, this will impede a simple vaginal delivery, and then it's up to the gynecologist or obstetrician to decide whether to proceed for the cesarean or not. At the time of birth, the weight of a normal fetus is about, as I told you, it's almost the normal limit is 2.5 to 3.5. Some books take as 3 to 3.4 kg, but this varies according to the region. And its crown length is about 36 centimeter, and crown heel length is about 50 centimeter at that time. This is the normal values which we take. Sexual characteristics are pronounced, and the testes should be in the scrotum. We all know, and we have studied in the last few lectures as well, that the testes are actually formed in the abdomen, and as they go down, they gradually descend from the middle of the abdomen into the inguinal canal and then into the testes, then into the scrotum. If they do not come, this is especially a disease called as cryptorchidism can occur. And at times what happens is the one testis is in the scrotum, other is lying somewhere in the abdominal canal or lying intra-abdominal somewhere in the abdomen. And why this is important is that testes need little normal than for example, our normal temperature is 37 degrees Celsius. They need 1 to 2 degrees less than the normal temperature to properly function. And in the abdomen, if they would be lying in the abdomen, this would result is that they would be exposed to higher than the normal temperature on which they can optimally function. This would affect spermatogenesis, and as a result, usually these patients who have the testes in the abdomen are sterile. And the other problem is that this can later develop into a testicular carcinoma. So this is very important thing, that the testes should descend down through the inguinal canal into the scrotum. But if they do not, if they're lying somewhere in the inguinal canal, they can be brought down depending upon where they're lying. But if they're lying in the abdomen, they have to be taken out, because later on this would be another problem for them. So what have we discussed? We have discussed what are the changes in weight during the fetal period, what has been happening through the fetus in the 6th, 5th and 6th months, and what are the development during the last 2 months, and how the weight actually rapidly increases. And for next sessions, keep watching sqadia.com.